Hi, my name is Ashley Croft. I am in the psychiatric mental health nurse practitioner tract, and I'm going to talk about my personal philosophy of healthcare and nursing as it applies to ethics and policy. When I think about this topic, I first really think about my own values and ethics that I hold personally in my own practice. And the first one of those is autonomy, like upholding autonomy for my patients and their own right to decide what their needs are and what they want out of their own treatment for their own health care. I think this is one of the topmost priorities that I have as a nurse to help my patients. The second value I hold in nursing is being an advocate for my patients. This is really at the heart of nursing and what we do as nurses, whether it's undergrad nursing for an RN or as advanced practice nurses. We are supposed to advocate for our patients, and sometimes that can create an ethical dilemma if we're supposed to advocate their wants and needs that differ from our own line of ethics. And I've had a lot of time to think about this, and in my experiences working as a nurse, I've been able to reconcile the two, for now at least. When I'm faced with a problem where my patient is wanting something that is in direct conflict with my own personal values, I go back to my first value of autonomy. My patient has the right to make these choices for themselves. They are an individual and their own human being with their own life experiences, and they have their own ideals and values that are important to them and directly coincide with what their goals are for their life, what they want out of their health care and out of their treatment to fulfill their own goals. As long as the desires of the patient aren't breaking any laws and are within policy and regulations, then it's my responsibility as a nurse to help them and to let them make that decision. Even if it's a decision to refuse treatment that I feel would greatly benefit them and their situation, maybe for their own lives and what they want to do and what they want to achieve, it's not the best thing for them. And that's something that I've had to reconcile in my practice, and that I'll continue to reconcile as an advanced practice nurse. But I feel okay doing that, and I've reached, I guess, a good place because I feel like I'm upholding what that patient wants. Policy is a major factor in nursing because it helps to protect the patient and it helps to protect us as practitioners and as nurses. And it's all about safety. So when we're practicing within policy and we're faced with ethical decisions between what is best and not necessarily what is right or wrong, then education is a key role. What I can do in that situation, especially for being in the mental health field, is if I have a patient who is seeking treatment from me and is depressed per se, I can give them all of the options they have available to them for treatment. And if I have given them every option possible and know that I am educating them to the best ability I have, then I can feel comfortable in helping them to make a decision. I can at least know that I've done everything in my power to help them make the most informed decision that they can. And then I just have to respect what their decision is, even if I think something else might be better. I can still speak up and let them know what I feel would be the best course of action, but in the end, it's their life and it's their decision. And we're just here to help them live the most full, healthy life that they can, which is pretty much what I feel like everybody wants for themselves. So I look forward to the rest of the semester with you guys.